Hello and welcome back to another episode of Change Talk. If you'd like to see more videos like these, please make sure if you get a chance to like our page below this video and to leave topic suggestions on our comment page. Alright, let's get started. We know we need to make an appointment to meet with a professional, whether it be our doctor or a mental health provider, but the first step can certainly be daunting. How do I know I'm making the right choice? Is there even a difference between therapists out there? Today we're going to be speaking about the various different types of mental health professionals in the market today and demystify the process of selecting one. It's also equally important to mention that today's discussion will paint a very broad and sometimes inaccurate brush when it comes to these professions due to the many variances that occur in both individual professions, their locality, and the amount of time they have been out of school. Let's first talk about some of the myths surrounding modern-day psychotherapists that might be dismaying for some people. If you notice in my office, there are no couches, stereotypical tobacco pipes, expensive artifacts. You most certainly won't be hearing anything having to do with sexual urges for your Freud lovers, and you'll rarely find me in a suit. To be honest, if I could show up to work each and every day in sneakers, I would. But in this profession, business casual is important and should be expected with your future mental health professional. One of the things you might find yourself doing once you're in a therapist's office is examining the various decorations during your first visit to a mental health professional's office. Hopefully, these items you see will be fun and intriguing. However, some professionals may believe that having too many decorations in an office can be a distraction. I, however, view these items as momentary breaks in eye contact, talking pieces, and as mood stabilizers, taking the client's mind off of the daunting process associated with feelings of being critiqued. Hence the stark contrast of differences you can see from professional to professional. To be completely honest, both sides have a point. But this is one of the plethora of items or circumstances that highlights that there is generally one provider that you feel more comfortable with, suiting to your individualistic needs. First, be leery of being recommended professionals from your school or doctor. These lists are generally outdated and tend to prefer larger organizations that pay staff members to lobby their cause regularly with the physician or school. Not to mention, these referrals these professionals make are accidentally assumed to be professional or therapists that they know, and it simply turns out to be the organization that the professional works at. This can literally mean that you are being referred to a mystery person or anyone that works for the organization. Considering the fact that many counseling practices today offer per diem services, big organizations typically have either non-licensed professionals or clinicians that have no reason to stick around very long, because they are private contractors with generally no real attachment to the organization due to being provided no retirement, no health insurance, and no paid holidays. Additionally, most schools or doctors' offices generally do not get a great deal of feedback from the families they send out, and hence these provider lists generally change very little over time. Furthermore, use caution when believing that larger organizations that have intensive outpatient, partial hospitalization, or various other programs have more options and are hence consequently better. Oftentimes, these programs have common educational plans and are typically developed to have similar formats and present information. So my advice is to do your own homework and search online and go with the individual that makes sense to you. Psychology Today and goodtherapy.org are generally great places to start if you don't want to do a simple internet search for psychotherapists in your area. Make sure to look at the provider's reviews and make sure that they are legitimate by looking at the creator's last name, meeting the risk that family members did the reviews that I witness from time to time. Also, keep in mind that typically when clients are mad, that they also write reviews even if the therapist had just caused in their associated previous action. An example would be a therapist who is generally considered a mandated child abuse reporter makes a report in response to a legitimate complaint or evidence that was collected. Typically, families, no matter how legitimate the case, will then write a negative review as perhaps a means of projection, retaliation, or attempting to blame someone else for their misdeeds. While going through the various search engines and profiles, remember the importance of choosing the right gender that fits your needs for a therapist. Having a male or female therapist might seem like a silly question for some people, but sometimes it can make all the difference in the world. Trauma, parenting practices, culture, identifiable, influential figures in your life, and so on can definitely help or hinder what you think and how you feel about your therapist. Some people incorrectly think that the same gender therapist is their best option. But the true test, of course, will be once you're in the room with that person. While those believe in gender equality are correct, The brain anatomy is often different between men and women, among several other general differences. Some examples include a larger corpus callosum in women and a larger overall brain in men, not even considering the hormone level variations. These variables often lead to personality differences in your therapist, and the only thing that makes one better than the other is what you are going to look for in your therapist. A concept that can be highlighted as being the difference between a therapist that is objective versus a therapist who is more of a feeler. Other variables to consider include your potential therapist's theoretical outlook. Does your therapist think that they have all the answers, working together with you to get the answers? Or is there a therapist out there that wants you to evoke your own very specific solutions to your unique problems? Generally, these roles are broken up into 3 titles: expert, guide, and student. Typically, visitors to treatment or clients that are not invested in treatment or think that they can't get help do better with student role therapists, and persons that often seek advice would do well with the expert variety. The guide role is sort of middle of the road, but generally this position does not fit everyone. A good therapist will alternate between these roles depending on the needs of the client or situation. Most therapists, however, do not possess this transitional ability, from my experience. When selecting a professional, a good possible hint towards their style of therapy would be the models they practice, such as cognitive behavioral therapy, which is the expert position generally, solutions-focused brief therapy, the student role, or person-centered therapy, which is more like a guide again. To get started, most of us know that psychologists and psychiatrists are some of the oldest mental health professions, but fail to understand the difference between the two. Do you know? Well, psychiatrists are medical doctors that specialize in the mind. They can perform individual and group psychotherapy. However, such practice is becoming scarcer and scarcer due to the real necessity for pharmacological and medical modalities of intervention, such as transcranial magnetic stimulation and various psychiatric medications. Psychiatrists specialize in trying to figure out all the ways in which your body, diet, and various other physical aspects of your life are affecting your overall mental health. Just to name 2 conditions that generally raise red flags are thyroid conditions and things such as PKU. There is also a large correlation between your brain and your gut, and guess what? From getting hangry all the time to eating too many processed foods that may bring about artistic qualities, these medical professionals are sure to crack down on many other variables that affect your mood and cognition, for sure, such as there possibly being a vitamin deficiency in the body of their patient. Alright, so next on the list, psychologists traditionally don't do medications, despite that beginning to change in 3 locations in the United States currently, where additional training grants certain psychologists prescription writing authority. Psychologists specialize generally in severe pathology and are awesome at conducting all sorts of tests to validate another clinician's diagnosis or to diagnose even more severe conditions. Oftentimes, you'll see psychologists heading research teams or as departmental leaders. Some hot topics that generally require a psychologist are severe personality disorders, schizophrenia, and autism. Psychologists generally view themselves as being the expert inside the therapy room and frequently conduct individual therapy. They usually hold their PhD or doctorate in clinical psychology and are referred to as educational or professional doctors. Typically, there are only a handful of master's programs for psychologists, since they generally jump from their bachelor's to their PhD, depending on the program they're in. Both psychologists and psychiatrists can usually commit a person for up to 72 hours to be evaluated in most states for acute psychiatric challenges. Now on to the less known differences between the more common professional counselors, marriage and family therapists, and social workers. Licensed clinical social workers typically can do both individual and group psychotherapy. And if you had to guess which professional you are currently seeing without any prior information, the odds would be in your favor. You were seeing a social worker, since they are so numerous. Social workers specialize in case management, which means they can help find resources needed in order for the overall physical and psychological functioning of their client. This can include anything from finding services, housing, professionals, or anything else that can affect a person's mental health. And guess what? They're really, really good at finding stuff. Social workers also have been around for much longer than the aforementioned professionals we're about to discuss further, and have deeper roots and privileges in state and federal legislations. Next on the list, marriage and family therapists can do a little case management, but typically are really good at couples, family therapy, or issues surrounding social and relational contexts. They are a little more unique with the regard that they have a tendency of considering almost everything in your environment, which might be affecting your mental health. This deviates a little from the traditional model of psychotherapy or the medical model. The medical model can be best encapsulated by stating that these professionals typically only respond to symptoms or complaints and are typically not very proactive. In contrast, marriage and family therapists generally view the client systemically, meaning that there are a variety of potential causes or things that exacerbate various types of pathology, and they typically explore all of these avenues at least once. Marriage and family therapists generally also consider themselves quasi-experts as well, often calling their clients identified patients. Lastly, professional counselors have a strong focus on both physical disabilities, mental health disabilities, vocational counseling, and issues surrounding overall development and wellness. We have a strong belief that the work that we do both defines who you are as a person and helps you find the purpose in your life that you've been working for. Work propels people to help others and in turn helps them to help themselves. Not to mention paying the bills is equally important and helps obtain the things that we need in life in order to sustain our mental health. Professional counselors also have a strong focus in individual and group psychotherapy. Since professional counselors focus on employment, they are typically also great at helping you with your resume and various other needs towards reaching your career and educational goals. Now, with all of these specialties listed, it's important to realize that many of these professionals can get similar training and generally have the capability of doing assessments, case management, and most other functions of these other professionals. Many of these skills can be picked up after college, attending seminars or certification training courses in order to pick up points or continuing education units towards their professional license each year, which is required in most states to sustain your professional license. Alright, since we now know about the generalities between professionals, now it's time to talk about some things to look out for. Furthermore, assessing the experiences and background of your therapist can be equally important and overwhelming. Does your therapist actually have experience treating children, have a degree to back up their specific population, example, treating mandated Department of Justice clients while having a degree in criminal justice, or have any useful services that might come in handy in the future, such as drug testing? Some professionals you may meet may never have seen the outside of a classroom, where a career student, and consequently green around the ears. In most states, a therapist can function without a license as long as they are supervised by a licensed clinical professional, following the guidelines of that specific profession. Typically, you will find most of these new or inexperienced professionals in cookie-cutter nonprofit programs. However, there are a lot of good reasons to still go with these programs. They can get special contracts and government grants for very specific programs that could be beneficial for you and your family. Often these programs are offered for low to little cost due to the government allocations and donations from the general public. However, a license typically signifies mastery in their field by completed associated hours of supervised instruction and passed a comprehensive written exam approved by that legislative body. Other things to look out for include the type of security your office uses when it comes to protecting your sensitive information. What does electronics have to do with the legitimacy of my treatment? Well, let's put it this way. If you are a mandated client or someone looking to take legal action, you not only want someone that takes thorough notes, but more importantly, a clinician that knows how to use a fax machine or send an email for those court letters that could mean the difference between freedom, prison, or a hefty civil settlement. Last things you might want to consider include asking how many times has your therapist been married? Did your therapist become a counselor to work out their own problems? And did they succeed? Does the clinician have to take special populations that they are biased against? Example, sex offenders or gender exclusive. Does your therapist consume alcohol on a regular basis? Sounds like hard questions to find out answers to, but just looking around the office or their internet page didn't tell you a lot about a person that you're about to put a great deal of trust in. Some good examples of detective work are looking at family photographs, if they have a court collection on their shelf, drinking merchandise, pictures partying, hanging their high school diploma up, postings indicating that they specialize in gender-specific issues, or etc. Yes, answers to these questions by themselves may mean very little, but the more clues that begin to add up, the better idea of what direction you want to go. For a basic fee, many good therapists offer in-person consultations or initial intake assessments, where therapists are often more inclined to answer personal questions. However, please don't call more than one therapist at a time and do what's called therapist shopping. Give that therapist that's meeting with you an equal shot for your intake. Just because you're beginning to use a therapist as your primary counselor does not mean that you have to stick with him or her. If he or she gives you bad juju, just move on. But also realize that if the solution was meant to be comfortable or known to you, chances are that there would no longer be that problem. Lastly, many therapists don't have receptionists. This is typically not a downside after meeting a clinician for the first time. Most insurance policies require to have some way of getting a hold of your therapist after hours. My practice, there's generally 3 ways to reschedule an appointment, which includes texting me, an online service called Therapy Portal, or calling my answering service. Insurance. I'll try to keep my composure during this section. It appears to me that each and every year that passes by, what insurance a prospective therapist takes is becoming less and less important, with $5,000 deductibles and the more common co-insurance slowly becoming the new standard. Typically, deductibles mean paying upfront first for associated costs until a maximum limit is met. This means that the days of copays is slowly fading and the new coinsurance is taking its place, which means that you pay a percentage of costs typically after your deductible is met for some plans. Typically, I usually see what's called a 80-20 split, which means that you are responsible for 20% of all future costs, even after your limit has been reached. That's, of course, if you plan to find a therapist that takes your insurance. One issue that is becoming even more of a problem these days is insurance companies attempting to influence provider coverage around the state. One way insurance companies do this is by having open enrollment periods for not only consumers, but providers as well, that typically go by county in which they operate in. This sounds like a great option for clients, encouraging providers to space themselves out. I don't know about you, but I own a home and I am unlikely going to uproot or find a practice location that is too far away from my home. So far, only one insurance company has denied me 4 separate times due to exceeding saturation limits in the area. Lastly, many providers try not to work with certain insurance companies due to treatment limitations and all the red tape. Examples include 2 popular insurance companies in Connecticut, requiring prior authorization for therapy sessions lasting longer than 45 minutes, and if the provider wants to conduct psychotherapy more than once a week. An example of one of my favorite cases is a severe case of mine being approved by the reviewing professional counselor that represented my initial contact with the insurance company, and then almost systematically failing the final review board process. For aforementioned reasons, more therapists are highly motivated not to work with some insurance companies. In response, if you choose not to work with your insurance, many providers will offer either similar fees to what you would pay using your insurance, or even offer an additional discount to spare the clinician associated grief dealing with some insurance companies. In the end, it might actually be cheaper for you not to use your insurance. Most clinicians are bound by the Health Insurance Portability and Accountability Act of 1996 that generally controls how your confidential information is being handled. I know a fear expressed to me on a regular basis is, I live in a small town, I don't want my problems becoming public. Trust me when I say, many of these laws are ironclad, and that the last thing clinicians generally want to do when they return home is to talk shop. Most exchanges of information require releases filled out by the client, and rare permissible deviations include consultations with other professionals and exigent or emergency circumstances. Another fear expressed to me by families is the mandated reporter designation that most professionals, from teachers to mental health providers, are bound by. This means that if a person is about to hurt themselves, someone else, or is hurting a child or elderly person, that this professional must notify the appropriate state agency or emergency service. Now, I wish I could put your mind at ease and say that this reality is nothing to worry about. However, depending on the perspective and comfort level of the attending professional, this could mean anything from no action to the clinician calling the police or a representative state agency. However, most of the time this action is necessary, and the state and local agencies are generally there to help. It is also extremely rare that, if this happens, that children, firearms, and even full-grown adults are going to be taken away for extended periods of time. Oftentimes, the crisis is handled professionally with extreme care given to the client, and the best interests of the client are upheld. That's it for now. To learn more about today's lesson, please visit our website at www.changetalkllc.com. Thanks for watching.